Helen.
We've just shot somebody.
Oh.
Unconscious, not breathing. No pulse.
This is the third time that someone has died at the hands of police in the last 6 months in the midst of a mental health crisis.
Michael needed help. He needed medical care. He didn't need 2 bullets through his chest.
It was clear that my son was shot in the head when he was on his hands and knees.
It's deja vu all over again to see these juries make recommendations about de-escalation, and then we see videotapes where there's no de-escalation.
And why, after the first 3 shots, when you can see a team falling to the ground, did Forcillo keep shooting?
It's really quite astonishing. It has to change.
You answer this call for help with 9 bullets! We want justice! We want justice! Our youth are our future. We have a right to live in safety and security! Drop the knife now!
Until the system starts to hold the officers who do these things responsibly, it's going to keep happening again and again. Little about Brian. He was the life of the party. He had a smile that would light up any room, would make the girls' hearts melt. He was a very good-looking boy. At one point, we were talking, and he said to me, I was watching TV, and they know my name. They know everything about me, you know, and I think it's when I went to the dentist and they put something in one of my tooth, and it's like a microphone, so I need to go get it out and stuff like that. And then I knew it was something was totally off.
Looked odd and potentially dangerous. Police came, it was appropriate. They don't see a knife at that point. This is all according to their own evidence. But one of the officers yells at him, "Get down on the ground." He says, "What for?" Very sensible question. The officer doesn't answer him. The 2 officers try and wrestle him to the ground. He breaks away.
You shout at somebody who's already in a crisis, it's worse. He runs, you run after him. Okay. I says, do you think maybe he ran because of the way you spoke to him initially?
But why didn't they answer his question, what for? He wasn't even agitated at that point, according to their own description. So I asked the officer that in cross-examination, and he says, first we get control, then I answer questions.
And they shot him. within 3 minutes of coming into contact with him, if that much.
My hope is that this inquest really underlines the fact that police officers should try de-escalation in all these situations way before they use weapons. From the evidence at the inquest, Michael Ellegon left the hospital wearing just a hospital gown, socks, and underwear, and a toque, I think. It must have been cold.
Hi, it's Kathy Radio. Hello. K154 for a stabbing.
Was he waving the scissors around?
Slightly.
Like menacingly or like confused?
Confused.
It was just tunnel vision straight ahead, walking towards a line of police officers. He wasn't running at them or going to attack them. He just didn't stop.
Right now.
Imagine being Michael Ellegon, shuffling along and whatever confused thoughts he had, and all of a sudden he's dead.
Toronto ambulance, where do you need us?
Hi, it's Radio Room.
Hi.
Can you meet us at 546 Milverton? We have just shot somebody.
Oh, okay.
We've got numerous units on scene. Is he conscious and breathing, do we know? Is the male conscious and breathing? Unconscious, not breathing. No pulse.
DSA. Okay.
DSA, okay?
This is the third time that someone has died at the hands of police in the last 6 months in the midst of a mental health crisis.
You know, I look back at all the inquests that happened before O'Brien's death, O'Brien's inquest that I spent many days in, and all the recommendations that came out of that inquest. And again, nothing was done.
Hi there.
What's bothered you today?
It's my son! I fed him! Breastfeed!
Okay, so what do you think the police can do to help you today?
You have the force officer!
How come you threw your medication outside? Well, it was a good call in the fact that the police officers backed off because she was so agitated and she's very delusional. So it was all just about de-escalating her and getting her to the hospital the easiest way.
The camera inside the car, okay? Video recording.
We're in an economic crisis. People are losing jobs, they're losing housing, they can end up on the street. And once you're on the street, you're quite likely to end up in some kind of mental, emotional crisis.
So this year we're on track for 10,500 visits to our emergency for mental health and addiction problems. I call it the $2,500 office visit because it's $800 for the police and the ambulance each, and then about $900 for a short stay in emerge. And that's a lot of wasted health resources. We should try and treat them before the crisis.
That is only a toy.
I know, but you can't be walking around with that, right? You're gonna generate calls for us.
I could talk to you for an hour about what happens to people.
I used to work at that hospital in the operating room, and here I am, St. Paul's, as a registered nurse. And here I am on the gutter.
How'd you get here?
Bipolar condition. It comes, creeps up behind you, and you know it's coming. It's like a bear. It grabs you in a bear hug, and there's nothing you can do.
Paul was born in Southern California. I was there teaching at Caltech for 4 years, and he was a really bright little kid from the very beginning, just full of life and joy, and also very intelligent. Mostly delusions of persecution, of people watching, and, well, even secret agent kind of things.
Hey, Chess. That's looking good. Paul's caring personality showed up in his animation in that he take time to do things well. Like the rabbit that he animated at the Quinty Hotel, a film that we worked on together. It was frustrating how long it took him to do it, but I also loved that he cared that much about it. That's definitely one of my favorite pieces of motion that he did and drawing that he did, because whenever I look at that part of the film, that rabbit running is Paul.
How he would turn a problem over on its head was always just really, really incredible to watch. I remember just thinking, wow, okay, yeah, that completely solves our problem, and I just didn't think that would come out of him because he was so quiet and shy. And he was often strangely like a little kid when he was happy and also when he was scared. His cycles started to get closer together, and he was having a harder and harder time. I think he wasn't sleeping as well.
The day that it happened, he called us to meet with him.
He wasn't Paul, and there was kind of the light was out or something. I don't know. I hadn't seen him like that before anyway. I hadn't seen him that far gone.
He now sounded much more psychotic than he had earlier on in the day. He didn't want to go to the hospital. He said it was just like being in jail there, and he didn't want to start from square zero.
Police say a man wielding a chain with a padlock struck 2 officers, and within seconds he was dead, shot several times.
Our officers are trained quite well, and they took what option they had to take.
His story was so at odds with the witnesses. They had no axe to grind. It was clear that my son was shot in the head when he was on his hands and knees. didn't see much assessment of the situation. They just were in it and suddenly reacting to it, and then Paul was reacting to their reaction, and it just went downhill from there. The police were the cause of the violence that night.
So that kind of understanding, it really is landmark, because it's far easier for somebody to be arrested, taken to jail, booked in, and then the policeman get back on his shift. It's a more difficult, complicated process to do what they're doing now.
What was that?
Whoa.
Yeah, they shot him.
I think what makes us so unique is the fact that we are a 911 responder. So when a person's in a mental health crisis and a 911's called, we're able to be there, and to be there generally within minutes. 10-4, thank you. Hi, my name is Sarah. I work with the Rapid Response Team with Hamilton Police Service. We just got a call from somebody who's a bit concerned about you. We're just a couple of minutes away.
A lot of tension in the house with my mother. She's very emotionally abusive. I have had thoughts, of taking a baseball bat and hitting her in the back of the head with it, but it's something I always tell myself, is it worth going to prison over? And the answer is always no.
Do you feel you need to go anywhere tonight? Do you feel you need to be out of the house tonight to keep everybody safe?
No.
No, okay. But if you need anybody to talk to, give us a call, all right? And if you feel any frustration, give us a call anytime, all right? All right, take care. Bye now. We diverted this young man away from the criminal justice system. We diverted him away from the hospital, and now he's going to be getting some counseling, which is exactly what he needs tonight.
The reality is a lot of these things unfold very quickly. So it's one of the reasons I think I have tended to go more for training, because the reality is it's going to be the uniformed officer who the vast majority of the time is going to be the one dealing with the person in crisis.
He'd be downstairs, just him and the kids, hours. Playing all these silly little kid games.
I just heard Michael come out of the room. I could hear his footsteps, and he walked past me, and when he walked past me, I realized he was completely naked. was very unlike Michael. Michael was very modest. And he was running very, very fast. Something that I'd never seen before in my life. It was basically delirium. I was just in shock. My sister called 911. There was many, many calls to 911. You know, man is naked in the street, he's running naked.
And he said, Michael, he said, your brother was shaking. He said, yeah, thanks, man, I'm kind of cold. I guess I am. And that's when he started to come north.
So I immediately knew something was off. He came up the driveway and banged on my window.
He picked it up and dropped it a couple of times, and that, oddly, is a symptom of complex partial seizure, picking things up and dropping them.
The officers were out of the car, guns drawn. He was coming towards them. I heard the shot, or shots.
From the time the police officers pulled up, we were told by the SIU that the GPS in the subject officer's car was 10:23:30. Michael was shot by 10:23:42, twice. The video we have of Michael sitting in the street crying and rocking is 10:23:46.
It was 12 seconds. No one wants to see an officer hurt or killed, most definitely. But the morning of December 2nd, that was not the case. Michael needed help. He needed an ambulance, he needed medical care. He didn't need 2 bullets through his chest.
Police officers are so reluctant to back up. I was one, I understand that. But sometimes, back up. Hold the fort if you want till help comes. You have to complete it every 3 years, and you have to go through a testing procedure. And if you do not pass that and meet the criteria, then that would be like not qualifying with your handgun. You'd have remedial training, you'd have a chance to retest and requalify. Or wouldn't be on the street.
Do it. Get on the ground! Get on the ground! Move it up! Still got
got the knives in his hands? Still got the knives in his hands. Still got his knives in his hands.
On our website, because I want you to go look at this stuff. I want you to share it with each other. We don't get a dime for you going to our website. Go to our website, grab these videos, talk about it, comment on the article. I just didn't put in because I knew we were going to be short. I was asked by a national news source, said, you know, Albuquerque, they're out of control. And they've shot all these people and nobody's been indicted. Any reason why? I go, yeah, because all the shoots were good. Well, 25 are dead. What does that tell you? 12 of them missed. And I'm not trying to be a smartass about it, but if you're going to start shooting at somebody, your goal is to stop that threat, right? Well done. We take statements.
These sort of independent organizations, particularly out of the United States, that specialize in delivering officer safety, survival schools, weekends, and what have you, I think has heightened the whole attention to officer safety.
Say what you'd say in real life. Ready, go.
Is your hand? Drop your gun.
Okay, what do you want? Hands, gun, what? What do you want me to do?
Drop the gun.
I'm dropping it. Bang, bang. Okay.
It's dangerously close to being a sort of a fear factor, and very often an irrational fear factor.
A minimum reactionary gap of 21 feet is required to react and deliver at least 2 rounds and to have enough time to move out of the attacker's path.
Head over to 546 Milverton.
Most of the time, when police are exposed to a sharp-edged weapon, perceived or otherwise, they're going to pull their gun. And there's advancement or not, they will discharge their weapon to prevent being at risk. I'm suggesting, and I'd state that under oath, that that's not valid. Suddenly Patrick comes at me, and just for purposes of training, it's an angle 1 strike. My hands are on the weapon, like nobody touches me. Because all it's simply doing is just projecting, you're looking at center line, and I'm going to be redirecting to the outside. And as you know, I was with 24 years with the Toronto Police Service. I finished off actually as a staff sergeant at the Ontario Police College. You may be shocked to know that we do more here today in sharp-edged weapon defense than the entire curriculum at the current police academy in Ontario. More depth, more detail, more options.
Drop the weapon.
Drop it. Drop it.
Police officers are generally trained today that a sharp-edged weapon doesn't always have to be a knife, but anything that cut or puncture skin is probably one of the highest level of threats that you can be exposed to. Generally speaking, you're taught that hand-to-hand defensive options are not an option. There is no negotiations, no wiggle room. That's the highest level of threat that a police officer can face. It's a firearms situation. We need to change the paradigm, how police are taught, so we can likely start to get some different results.
Do you think that man would have survived in North America?
No. No.
I happened to be doing some graduate work over at the University of Cambridge at the Institute of Criminology. And that's about the same time that the advent of the first wave of body cameras started to come about. We partnered up to do a year-long randomized control trial to really test the impacts that those body cameras would have on police officers. The results for the experiment were, I think, far better than we actually expected.
¿Cuál es su problema?
We had about an 88% decrease in complaints against police officers and about a 60% reduction in the amount of times that we used force.
Hey, Carlos, what's going on? Why'd you hit the door?
Because my all started crying and screaming.
They're both scared of you. There's a lot of holes. I don't think that knocking or trying to get the door open requires that many holes in the door. What are they saying? They're stating that you're saying that you're God or something?
That's not true. It's diagnosed now.
Whether it's a mentally ill person or not, I think that the general interaction with an officer and a citizen is going to be a lot better. I think they'll increase their communication skills and be more willing to talk to the individual.
His ability to move is not completely obstructed by either the officers or by the vehicles, but he is more or less surrounded. You can see the man pacing around on the street or moving forwards and backwards, side to side, front and back, each of them trying to continue to verbally de-escalate the situation over a period of time. You could probably say they've contained him without restraining him. And they keep this situation going backwards and forwards for some minutes whilst other officers are bringing what we would call public order shields to the location. And in a coordinated movement, they move towards him so that there's no way he's going to be able to use that weapon or go anywhere else. He's ended up placed on the ground with the use of the shields, the weapon's taken from him, and then he's stood up and handcuffed and detained.
Do you think that man would have survived in North America?
No. No, he wouldn't have survived. Wouldn't have survived a couple of minutes, probably.
So what's to be learned from that?
Well, it is doable without firing your firearm.
Put the hammer down and we can come and help you.
Please help me! Please help me!
Put the hammer down and I'll come and help you. Well done, Paul. I don't need to hurt you, do I? Okay, so move away from the shield for me. I'm just going to keep coming towards you with the shield so that you don't make any sudden movements. We're not going to put your arms out to the side. I'm not going to hurt you. I'm going to put this up against you just to make sure that you're not going to hurt us. Okay.
Please.
Checkmate, thank you very much. Index.
Reform outside for a debrief.
It was a case for me of trying to gain his eye contact, trying to speak to me rather than the other person that he could see in the room.
If all of us had been shouting at Paul, that would have just made his condition worse because he's already hearing voices in his head. You've got 5 or 6 people shouting, barking commands at him. That could have tipped him over the edge. So the decision we made before we go in, there'll be one person speaking so that Paul can focus on that one person.
Because once you've deployed the weapon, actually, are you creating a situation where, you know, someone being shot is what's going to happen? by simply having a process where you are authorizing things, it gives time, it gives space to try and de-escalate the situation. Tasered as well. In that scenario, a knife, we probably may not even deploy firearms to that, and we would give that person space. I think we would only intervene with a firearm if that person was actually then threatening another person, actually was holding them hostage and was going to harm them. And even then, we would, as the sort of expression goes, we would play it long.
Female on the line saying she's suicidal, doesn't know what to do. Apparently she's got a CPN and she's with the crisis team, but she's not engaging.
Got a date of birth for her? Yep, she's open to services. Didn't attend her last appointment on the 25th of February.
She states that she's been having thoughts of taking all her medication or slitting her throat. She states without her partner she would be dead.
Okay, there is an ongoing increased high risk of her taking overdose of her prescribed medication as her way of self-harming.
Okay, high risk.
When boyfriends come to find her, she's jumping in and out of traffic, threatening to jump in front of cars.
You come in and grab a pew, which is so much better in here. So what's happened today?
Stop taking my tablets. I have mad mood swings and my partner can't cope with it. So he was on about leaving and then I threatened to kill myself.
At that point in time, was it that you wanted to actually die and never wake up?
No, I just wanted to get out, just stop everything.
To stop.
Yeah, just.
Yeah. Do you know what your tablets are for?
Yeah, it's to keep me calm and to keep me straight. I didn't want to be on tablets for the rest of my life, basically. So I tried to fight it, and I just made myself worse. I know what I've done, and I know that I need to take my tablets, and I know that it's not right, and this is what happened. Thank you so much.
It's all right, not a problem.
I go home.
Yeah. Let me come and speak to Grandma and boyfriend.
Thank you.
Not a problem.
Let's get in the warm.
Yes, you can get in the warm now. Okay.
And when do you guys graduate?
Next week.
Next week.
Next week. Hopefully.
Game's on.
I'm not satisfied that police agencies routinely hire the right people. I don't think sometimes they're paying enough attention to some cautions that are put up by, for example, psychological screening or even polygraph, integrity screening. And they, quote unquote, take a chance.
Game's on.
Get out of my area!
Ma'am, is that a knife in your hands?
We want to have a conversation with you, but we can't do that with a knife in your hands. Can you drop the knife for us so we can talk?
You got to do what you got to do to help people at moment or in crisis. Stay grounded and don't let emotion take over. Don't let fear take over.
They should have just spoke with him. Take the time. There was no rush that morning.
You really don't realize the impact until it happens to you. And you definitely don't want to see another family go through what we did. It's horror. It's absolute horror. And it changes you forever.
And I kept going over my notes, and people kept telling me to not go over my notes so much because I was going to confuse myself. But it was good because by the time I got the test, I knew all the answers. I saw him there, and I was surprised to see him. He looked all dapper and stuff. And then, like I said, you know, I'm so glad that you're here, you know? And then I was like, in my dream, I felt like I was about to cry or something. And like, you know, I was trying to hold it in, and not cry.
I think you've chosen a wonderful profession. Paul was always extremely happy when he was working on animation. And I think sometimes it's a little hard to find. He was one of the best animators in the city and had a career and was admired by everyone and was this really wonderful guy to work with. Paul was portrayed as being some kind of brute instead of actually realizing that there was a person there, a really valuable person.